ran a half marathon. I made spending time enjoying the outdoors a priority. I completed 4 10K races. I was working out 5 to 7 days a week. And at 33, I was diagnosed with stage 4 lung cancer.
That's not a rare story. It's happening every day. And here's the reality that should give us all pause. We are now seeing more women diagnosed with lung cancer than ever before. In many cases, more women are now expected to be diagnosed than men. And that doesn't fit what most of us think lung cancer looks like. And that's the problem. My name is Dr. Stephanie Snow. I'm a medical oncologist at the QE2 in Halifax, Nova Scotia, and the immediate past president of Lung Cancer Canada. And I'm very pleased to be co-hosting today's conversation with my colleague, Dr. Rosalyn Juergens, a medical oncologist at the Juravinski Cancer Centre in Hamilton, Ontario, and the current president of Lung Cancer Canada. Today, we're honored to be joined by an extraordinary group of women whose lives have been touched by lung cancer, each with a unique story to tell. Stories that are deeply personal, but also reveal something much bigger. Stories that challenge assumptions, that force us to pay attention, and ultimately, that compel us to change. Women, daughters, mothers, sisters, being told it's nothing, being reassured, being sent home, not because they aren't sick, but because they don't fit what we still expect lung cancer to look like. Women, often without obvious risk factors, who simply aren't seen as being at risk. And by the time the system catches up, they've already lost time that they didn't have. Let's talk about a few statistics. Lung cancer is the leading cause of cancer death in women in Canada. More women die from lung cancer than breast, ovarian, and cervical cancers combined. And still, we are missing them. We are not failing to detect lung cancer. We are failing to recognize it because we are still looking for something different. This has to stop. I'll now turn it to Roz to help frame the conversation ahead.
Thank you so much, Stephanie. As you can imagine, this is a topic near and dear to the hearts of all of us on the panel today. I want to echo everything that you have said. And honestly, it's a privilege to be part of this conversation and raising awareness. As Dr. Snow has said, we're here today because the reality of lung cancer is changing, and our system has not fully caught up. We're seeing more women diagnosed than ever before, including many who do not fit what we traditionally think of as being at risk. And that disconnect is where we're seeing real consequences. What we're going to do today is to explore the gap by looking at the patient journey, from awareness to screening to diagnosis to referral, and asking a simple but important question: where and why is this pathway failing women? Because what we're seeing is that for women, delay isn't a single moment. It's layered. And it continues throughout screening, it compounds over the diagnostic journey, and it doesn't always resolve even with that original referral. And the goal of today's conversation is not to just understand that, but to begin to identify what needs to change. Before we continue, I would like to acknowledge that we are joining from many places across the country on lands traditionally stewarded by the First Nations, Inuit, and Métis peoples. We recognize and respect their enduring connection to this land and to their communities. And as we talk about gaps in care and unequal outcomes, we acknowledge that these challenges are not experienced equally. This is something we must continue to reflect on as we work towards change.
Thanks, Roz. For those of you new to Lung Cancer Canada, we are the only national health charity dedicated exclusively to lung cancer. Our role is to bring together lived experience, clinicians, researchers, and system leaders to ensure that lung cancer is not overlooked and that people receive the care they need when they need it. Today's discussion is part of the Lung Cancer Canada's policy series, where we are bringing together leaders from across the system to focus on the issues shaping outcomes in lung cancer. These conversations are designed not just to understand the challenges, but to identify actionable solutions that inform our advocacy and policy work. Today's policy roundtable isn't a panel. It's not a presentation. It's a working conversation. Let's begin with some introductions. I'm going to invite each participant to tell us your name and the perspective you bring. Why don't we start with you, Emi?
Hello, everyone. My name is Emi Bossio. I live in Calgary, Alberta, and when I was 47 years old, I was a practicing lawyer here in Calgary, a mom of an 8-year-old and a 15-year-old. I was super careful about my health. I checked all labels for cosmetics. I ate organic. I watched what I ate, and I had never smoked in my life. And all I had was just a bit of a nagging cough, which turned into a shocking diagnosis of lung cancer. That was in 2019, and thanks to research, I'm here to continue to talk about it on this panel. Thank you for including me.
Thank you, Emi. Laura, would you like to introduce yourself?
Thanks, Stephanie. My name is Laura. I come to you from Victoria on the unceded lands of the Lekwungen-speaking people. If you'd asked me 10 years ago which cancer I would definitely never get, I would have said lung cancer. 3 of my 4 grandparents were quite heavy tobacco users for many decades, and none of them developed lung cancer. And my brother and I used to joke, well, at least we know this is the one cancer we will never get. So it was a really big shock to find out in 2020 that I had, in fact, developed lung cancer. And I've been on that journey for just over 5 years now.
Thanks, Laura. And last but certainly not least, go ahead, Bev.
Thank you very much, Stephanie. I'm pleased to have the opportunity to add my voice to this conversation. My name is Bev Moir. I live in Toronto, and I'm a wife, a mother, and a grandmother. In the spring of 2019, I had a lingering cold. I went to my family doctor thinking I had strep throat. She'd send me home with an antibiotic and I could continue on with my career and my very active life. And she thought I had pneumonia. And thanks to that alertness, she ordered a chest x-ray, which I eventually learned showed metastatic nodules in both upper lungs. And I was diagnosed then almost 7 years ago with stage 4 EGFR lung cancer. And like the others, I've never smoked, very active, and it came as a big shock.
So why don't we move and really start the conversation by looking at the patient journey. It starts with that awareness. Sometimes that's a symptom, sometimes that's an imaging finding that's caught unexpectedly. There may be an opportunity for screening. That is a gap, in my opinion, that really needs to be filled. People then enter in the diagnostic space, and then eventually there's a referral. So people move from this concept of awareness all the way through that original referral for the right treatment specialist. So where is this pathway failing women? And importantly, at the same time, we're now seeing that more women are diagnosed than ever before. Actually, for the first time, we will find that more women will be diagnosed in this country than men will be diagnosed in this country with lung cancer. The system is still oriented, though, around a traditional risk profile. And I think that that's one of the many spaces where we're seeing breakdowns. So the question for us today is our system actually aligned with the reality of lung cancer as it exists today, as opposed to where it existed 20 years ago?
So now that we know that more women are being diagnosed, many without obvious risk factors, I'd like to hear from our participants today. How did that reality show up in your experience? What were you told? Were you taken seriously? Was lung cancer considered early? I'd love to hear more of the stories of our patient participants today. Emi, why don't you start?
For me, I was always active and I tried to be as active as possible, took the stairs to work. And obviously, no one ever exercises as much as they want to, but try to do all those things, eat healthy. But I did have a nagging cough. And so I went to my family doctor at the time, and she just said to me, "Oh, it's Calgary, it's dry. You've got kids, you're probably just always getting sick. Don't worry." And that was in about January. And I did go back and I kept being told the same, not to worry, it would go away. And finally, um, I was told to use a neti pot, which I think actually gave me a pneumonia, which turned out to be a really good thing because then I went back and I was now feeling really sick. And so my family doctor finally agreed to send me for a chest x-ray. And as I was walking out the door, she stopped me and said, "Don't worry, you're a never smoker. You don't have anything to worry about." And so I went and had my x-ray and it only showed a pneumonia. So I was pretty grateful for that. And I dutifully took my pneumonia medication and it didn't help. And so I got more pneumonia medication, different pneumonia medication, and it still didn't help. And I got a third batch of pneumonia medication, which still didn't help. And at that point, the x-rays that I was being sent for, finally, the x-ray technician said, "We really think that this patient needs a CT." And at that point, not surprisingly, I really started not to feel well. And my family doctor ordered a CT for me. This was in early September, and it was scheduled for December. And I said, this can't be right. I'm not feeling well. I could only work half days at that point. But my family doctor at the time just sort of shrugged their shoulders and said, "Well, if you don't feel well, go to emerge." And I just thought, well, this can't be right. This can't be the right answer. So I did go and seek a second opinion. And they said to me, "Well, you really need a CT." So ultimately, I had no choice. And I just went and I actually had to pay for my own CT because I couldn't work. I couldn't really function. I needed an answer. And as soon as I got those CT results back that same day, the new family doctor sent me to emergency right away. And when I told my emergency doctor that my regularly scheduled CT was for December, she started to cry. And I took that as not a good sign. And that's how I was diagnosed. But it took almost 9 months and multiple doses of pneumonia medication and an assurance that I had nothing to worry about because I never smoked from a family doctor before I was diagnosed.
Thanks for sharing that, Emi. Laura, how was your experience of being diagnosed and presenting with your symptoms and figuring out that you had lung cancer?
Yeah. I think about calling myself a unicorn because in my 5.5 years, I've never met anyone who's had the same experience I have, which is that the very first time I got in contact with the medical system, they found my cancer like the same day. And so when I tell my story, I always, now that I've heard lots of other people's stories, I just point out all the things. It's like that map of the survivor bias with the plane, and it shows all the places it got hit. And it's like the important thing is where it didn't get hit. So in my story, I'm like, okay, here's what didn't happen to me. Because the first thing that didn't happen to me is my family doctor didn't dismiss my symptoms. And they were super duper vague symptoms. They were just like, I don't feel well. I have a high heart rate. I have blood pressure is way up. My chest feels kind of tight. Maybe there's chest pains. I'm having trouble doing exercise. And I was very lucky to have a doctor that I'd been a patient of his for 7 or 8 years, and he took me seriously. And he said, go get checked out. Go get checked out at the ER. It's probably not a heart attack, but just be sure. And just having that validation is such a step, because so few women get that first step validation. So few women get told, yeah, check it out. It's the opposite that usually happens. And so I did wind up going to the ER, which I'm lucky to live in a town where the ER is 10 minutes from my work. And the second thing that didn't happen to me is the ER wasn't busy. And you're probably thinking, where does she live that the ER wasn't busy? And I tell you, it is not like that anymore. But this was during the weird pre-vaccine time when people were avoiding the hospitals because that's where all the COVID was. So I go into an ER that normally might have 30 or 40 people in it, and there's like 6 of us. So when my labs come back fine and there's nothing wrong with my heart, I'm sitting in with the doctor and I'm waiting for the next line to be, thanks for coming. Don't let the door hit you on your way out. But instead, she says to me, I see that you marked shortness of breath on your form, and I'd like to send you for an x-ray. And I think about that moment a lot, because in the time after my diagnosis, I met with a group of about 6 women who were about my age, 30s, 40s, same thing with no obvious risk factors. And that was the moment that was missing for all of them. That was the one where the doctor said, let's run one more test. Because I went for that x-ray and she said, there's something on the x-ray. I think we need a CT scan. And then she did the CT scan and she said, I'm going off shift, but my colleague will be on, and he'll probably write you a prescription for antibiotics for an infection in your lung. And, goodbye. and she went off shift. And then I go in the little waiting room and the doctor comes in and he's crying. And I'm like, I don't think that's a lung infection. But that, to me at the time, I'm like, this is so incredibly traumatizing. And then you hear all these other stories and you think, like, that's maybe the least traumatizing way to find out, where you get an answer right away. I mean, it was absolutely life-shattering, but it wasn't after, months and months or years of waiting. And all of those women that I was friends with, all the ones that I met in that first year, the reason I'm here on this panel is none of them have lived this long. All of them have already passed away, because they were diagnosed at a much more advanced stage with so many fewer treatment options. And so that's, in a way, one of the reasons why you'll hear more stories, maybe like mine in these panels, is because we're the ones who have a bit of a survivor's benefit to it. Just being caught before it's hit stage 4 really opens up treatment options that don't exist. And so many women don't get options that they might otherwise have had. If someone had said, let's run it, let's do an x-ray, let's do that CT scan, let's run one more test and just be sure.
Thank you, Laura, for sharing your story, and also for providing a voice for those who are not here to share their stories. Bev, I'm going to open the floor for you.
Thank you so much, Stephanie. So I'm going to go back 6 months before I showed up in my family doctor's office. And I had a cold then as well. And I had zero awareness that a lingering cold could be something more serious than a cold that's going around the office. It was Christmas time. I had trouble reaching my family doctor, and I was coughing so much. I went to a walk-in clinic, emergency walk-in clinic. I don't mean to sound sexist, but it was a young male doctor in this walk-in clinic, and he sent me home with 100 mils of a codeine-laced cough syrup, which probably wasn't good if I had pneumonia, because you want to get the phlegm out. But it was a missed opportunity to have not considered potential diagnoses. When I saw the doctor, she did take me seriously, ordered the chest x-ray, only discussed pneumonia. But what's very interesting, and it's picking up on something you mentioned, Laura, is it took me another several months before I realized that I learned that chest x-ray showed metastatic nodules. She probably had a strong sense that I did. She knew I had cancer somewhere. She probably had a strong sense that it was lung cancer, and she could not tell me. What she did do is refer me to a respirologist who I see for chronic asthma, and he referred me into my current hospital. And then it was another 6 months, or excuse me, 3 months of a lot of diagnosis and tests. Never once had I heard the C word. So when I finally did get the diagnosis, it was a real shock because, like others, I was in my late 60s at that time, but very, very active and always very healthy.
Thank you, Bev.
You're
We've been
welcome.
joined now in a conversation by another very important participant, a little bit different. We have a mother joining us. I'd like to welcome Frances Cerato, who is the mother of a very important lung cancer patient who was very important to lung cancer. Canada has left a huge legacy behind, but she's not here to tell her story today, Anne-Marie Cerato. So Frances, if you're comfortable sharing, reflecting on your daughter's experience, does this idea that lung cancer wasn't even expected help explain why it took time to be recognized?
I think there's maybe a wee bit of a lag there.
Yeah. Or maybe she's frozen. Okay. Well, we'll give Frances another few chances to sort out the technical issues. Emi, I was going to ask you another question, though. It sounded like your story was really plagued with delays and having to keep on representing and advocate for yourself. Do you think that if those same symptoms had been presented by somebody who fit the traditional risk profile, for instance, somebody who was older, perhaps of male gender and had a tobacco history, do you think the response of the system may have been different?
Well, I think that to Laura's point, once you start meeting others in this group, you think, for me, I just assumed I had a very bad one-off experience. But the reality is, the more that you talk to people who are diagnosed, particularly the younger women, and even younger males too, that don't fit the profile, what you find is that this is a really, really common occurrence, and that this happens unfortunately all the time. And I can only hope that at least that those that fit the stereotype are being seen. But I think that in general, there's just such a low profile for lung cancer, that lung cancer is really, put off to the side and stigmatized so much by everyone that in fact there's not enough awareness, even in the sort of more classic or more expected or more high risk groups. But particularly then when you add in, there's so many family doctors and other doctors now that I've spoken to that frankly didn't know to expect lung cancer in anyone that has lungs. And that's a real awareness problem. And that's why these policy forums are so important, because we really need to raise awareness for everyone.
Thanks, Emi. And you know that phrase that the only risk factor for getting lung cancer is having lungs is one of the more powerful ones that we hear over and over in Lung Cancer Canada. And the first time I ever heard those words, they actually came from Anne-Marie Cerato way before COVID at one of our lung cancer evenings of hope. And so now we've got Frances rejoined. Hopefully we'll be able to hear her story and the story of her daughter if we've gotten our technical issues figured out.
Can you hear me now?
Yes, we can hear and see you perfectly.
Can you hear me?
Yes. Great. You go ahead, Frances.
Wonderful.
The floor is yours.
Thank you. Thank you. Anne-Marie was diagnosed in '09, and it was kind of a fluke. And as another person said, thought she was a unicorn as well, because she never smoked and she was young, active, starting off in her career. And she went to the doctor to see about a node that was on her shoulder. So the doctor said, okay, we'll send you for an x-ray and, see if there's anything there or whatever. So from there, the doctor was very quick when he got the results of the x-ray. And he sent her for a scan. And then after the scan came back, he wrote her a list of appointments that started the next day. He was very, very good, very quick. Everything started she had meetings and appointments, consultations, scans, you name it. Everything was done very, very quickly. So quickly, in fact, that there was a lot of things that, she couldn't do or even think of at the time. Nothing was really going to work with the schedule of appointments. And when at some of these meetings, stage 3 adenocarcinoma, and the regime was to be radiation, chemotherapy, surgery, and chemo again. So this was in April that all this started. December 24th, she had her last chemo that year. And after that, came back again. During the time that she was going to Sunnybrook for all the chemo and everything else, all the consultations and scans and, the regime. Every time that we went there, everybody thought that it was me, not her, that had the cancer. And even I know that she got quite frustrated when people would ask her how long she had smoked. Even the doctors. I mean, doctors, I guess some of them took it for granted that, this is a lung cancer and it would be in smokers mostly. But anyway, in that time that the cancer came back again, she was basically told that it was too small for anything to be done at the time, just to sit and wait kind of thing. And when it got bigger, then they could maybe do something. So, and that was it, go back home and wait kind of thing. And this is not Anne-Marie. She was very tenacious, very aggressive. She wanted to get this cancer, out of her. And she wanted to do everything possible. So she tried to see if there's any kind of supports or anything, because really the doctors, after they had given her that, kind of, if you have any money, do what you want. And, you're not going to be here for very long kind of thing. This is the way it was taken in any case. And, but she found a young yak and some of the other support that I guess were coming up at that time. I don't know about now, but the way everything went for her, it was good because everything was fast. But I know now, as Emi told us, that sometimes, I don't know, for months and months and months. And this is not good, especially if for lung cancer. I mean, the quicker the better. I had so many things to say. Then after she got the diagnosis that had come back, she looked into everything she could, and she found this. Sorry, my mind is. The words aren't coming. She found the trial for Chris Ottenham, and she told her team at Sunnybrook, which had been great until that time. And then they didn't know anything about any trials, for one thing. And this one was right next door kind of thing. It was at Lake Ridge. So she got on the trial. They processed everything, that you have to go through to test the tumor and everything. And she did get the actual drug, which was great for her, because it allowed her many, many years now of life. And but during that time, of course, I mean, there was I was always with her. I mean, I'm a widow, and she was at home at the time, and she was only 30 when she got diagnosed. So it was endless trips to Lake Ridge, and for many years, and that was with Dr. Rosenstein, I believe his name was. And then it kind of progressed to I don't know if it progressed or the trial changed, and it went to Princess Margaret, and she had a wonderful team there as well. It was just great, but it was always ongoing. Like, it's either the treatments are either every day or every week, every month, every few months that you have to go in for different other things. So it was just an ongoing process. And with me, with the history that my family has had, my mother died of lung cancer when she was 54. And that was back in the 70s. Then it was lung cancer. It was just a malignant tumor. There was no mention of the C word whatsoever. And at that time, we didn't know either. Then my dad passed away when he was 76. My husband passed away from lung cancer as well. My husband passed away at the age of 61 with mesothelioma, I think it's called. And then Anne-Marie with lung cancer. So it's been quite an experience. So when you hear lung cancer, you can relate to a lot of people. I don't know what else to tell you. If you have any questions, I know that she was very adamant when she found lung cancer Canada that she went gun ho, and she went all over the world to tell her experience and her story and to advocate for lung cancer.
Absolutely. Thank you for sharing your story, Frances, as a mother. And certainly Anne-Marie touched so many patients, so many people, so many physicians and other healthcare providers, and her legacy, we will make sure will live long, especially for other young adults living with lung cancer. We have a very special bursary in her memory to support young people who have lung cancer to attend international meetings and other meetings in order to make those connections and get their stories out there. So thank you. So everybody has provided us with a different...
Just another...
Absolutely, please.
I just have one other thing, that I think that lung cancer does not get enough funding, enough notice in the media. And if you can't breathe, you can't live. So I think this is very important to really get it out there, that it doesn't, smoking is not just, lung cancer, as another person said, life and not get it. But if you have lungs, you can get it. And people are not aware of that. And they should be really, that should really have a focus on either advertising or whatever, advocating that, and also that it's one of those important cancers that you have to catch early and have funding for it, research. Thank you.
Absolutely. So true, Frances. And I think that that's why this conversation today is so important. And we're really going to be talking about some exciting initiatives, not just recognizing the problem, but hopefully by ending up today with some potential solutions and ideas to address, because you just hit the nail right on the head, Frances, with a lot of the issues that we face. We've heard from everybody's unique story that awareness is low, not just among the general population, but we've heard every single story. Physicians expecting it to be a pulmonary infection, and sometimes just not being able to deviate from that narrative until you've had 1, 2, 3 courses of therapy that just didn't work. And we know that unfortunately, our patients, our women with lung cancer, are not unicorns. They are actually quite common. And so this awareness is very much misaligned with reality. So I'm going to pass over to Roz now, and she's going to take us through some content considering the system and where the breakpoints have existed in that system for those of you who have lived this experience.
Yeah, thank you, Steph. And I realize that this is not unique. You've absolutely got that right. I just saw a young person with lung cancer. That CAT scan that their family doctor did order is booked 4 months from now. They got to see me because they ended up presenting to urgent care or emergency care, and that's what ended up speeding up the process. So that beginning part in the pre-contemplative, the pre sort of understanding phase can really draw on and on and on. Let's now pivot to, where do we go once that suspicion is really now front of mind? So once lung cancer is actually now part of what we as physicians call the differential diagnosis, we're actually considering this as a possibility. Does our system actually move quick enough once we think that this is a lung cancer? Or are we seeing additional delays in what I call that diagnostic phase, once cancer is being suspected or even confirmed, and we're trying to put all of the pieces together to actually make the package that the physicians need to be able to make a treatment recommendation? So, let's talk about, did all the right tests get ordered? Were they ordered quickly? Or did it still feel very uncertain? So when someone said, we're worried that this is lung cancer, did it still take many, many months of time to be able to get to what the treatment recommendation was? So did you feel like your lung cancer diagnosis wasn't being acted upon quickly enough? So let's talk a little bit about that first steps and that diagnostic phase, and then again, last but not least, that eventual referral to the right treating physician. Let's look at that aspect of things. So I'm going to ask the panel, looking back, did it feel like the system still struggled to see what was happening because you didn't fit the expected pattern of who gets lung cancer? Maybe I'll start with Bev.
Thank you, Roz. I suspect they might have thought that I had lung cancer, but it was probably 6 to 8 weeks before I reached a diagnosis. And what ended up happening is I was referred into a Cancer Care Ontario funded program that, in retrospect, I believe was not funded as part of my hospital. So I was kind of outside the system. And it always seemed as if I was waiting a long time to get appointments, to the point that I actually found a patient navigator in the hospital. And this is a large teaching hospital. And I also found a gentleman who booked scans, I believe. And I said, look, I'll come in at 1 o'clock in the morning 3 in the morning. Just, I live not that far away. Get me in. And I also waited 3 weeks. And this is 2019. So the system has improved at the hospital and in Ontario, hopefully better since then. But I waited 3 weeks for the results of the biomarker testing. And at this point, I knew that I had lung cancer and that my treatment was not going to start until I had the results of the biomarker testing. They now have adjusted things in their labs. They've new equipment, additional resources, and it's happening much quicker, so much quicker that the lab expanded their catchment area because word got out in the community about how fast they were delivering the results. But it was a very, very frightening, fraught time. And, I'd like to think that things are much better since 2019. But I also recognize that my story illustrates the diversity across Canada and the differences between, Ontario, which is an affluent province, lesser funded provinces, the difference between I'm in an urban setting, and the north, east and west. So there are a lot of system problems that are yet to be resolved for lung cancer.
How about you, Laura? Once they dropped that bombshell on you that they thought this was lung cancer, how long before you actually met with the right person to actually give you a recommendation on treatment?
Ooh. I think that's, for me, there's two angles to that. In some ways it was really fast to see the right person, but that person didn't turn out to be the right person, if that makes sense. So I'm in the hospital and the doctor's describing a mass with, what did he say? Characteristics of malignancy. Because I understand now that the ER doctors can't say cancer. They need to have the sample under the slide that says it's cancer. But of course I'm there very confused. I'm like, so it's cancer. He's like, well, the characteristics of the mass indicate malignancy. I'm like, so it's not cancer? He's like, well, I'm like, okay, no, never mind. That's all right. What are next steps? And things moved really quickly from there. I had another scan that night in the hospital because, again, it was super quiet. And then I met with was assigned to a respirologist and had a bronchoscopy, biopsy, results all within a couple weeks, and I was referred to a surgeon because at that stage I was considered to be stage 2, and in British Columbia, where I'm treated, stage 2 cancer patients, solid tumor cancer patients, generally get referred to a surgeon. And so all of this, I'm meeting with the surgeon within 2 weeks, and I'm like, this is great, this is incredible. And I do some research on the surgeon, and there's an article about how they had just finished a project to streamline the surgical pathway for a lung surgery for cancer patients, and interviewed one of the surgeon's patients who talked about how fast everything went and how the surgeon actually monitored him so closely that the doctor caught the symptoms of a recurrence before a scan did and got the patient back in and did a minimally invasive surgery and was out in 2 weeks and back on the golf course. And I'm reading this and I'm just like, oh my God, I'm over the moon, right? Because I was like, I'll be back at work. It's October. I'll be back at work by January. Like, it's like going all like fresh faced and excited to sit in and meet with this surgeon. And it was like this big dampener came down. And the attitude of this doctor was like, what are you so freaked out about? What's the big deal? Like, calm down, lady. Like, what's going on? I felt like I was just like, wait, what? Is this not a big deal? Should I not be stressed about this? Because I'm pretty sure all the statistics I've been reading have telling me to like completely freak out. And so there was just this really kind of patronizing sense of like, you're being emotional, you're being ridiculous. And I would sit in these meetings and I would just cry. And I was like, I don't understand what's happening. And at one point they said something to me along the lines of, well, your cancer's been growing for years, so a couple months isn't going to make a difference. And then a couple months passed and my cancer progressed and I was no longer a candidate for a surgical cure. and I had to get transferred to the actual right people. Pardon me. At the BC Cancer Center. And so, yeah, that took 8, 10. So it took from the time that they found the tumor that night, very obvious golf ball with tentacles, type tumor, to when I started my treatment, it was just over 3 months. And so that's when I say, like, yeah, things happened really quickly. And then there was like a huge pause where one person just decided that my case wasn't that urgent. And it wasn't until the panel that I was going over the questions that it occurred to me the patient that had been interviewed for the article was a man in his 70s with a history of smoking and, wanting to go back to the golf course. And I just couldn't help but wonder, like, if I showed up as an otherwise pretty healthy, 40-year-old woman, that he was thinking, well, I see all sorts of really sick people and you're not really that bad of a case. So, like, I mean, you never know. These are the things, right? You'll never know what difference that would have made, but it's hard not to wonder because there was a window there. And, instead of having just a straightforward surgical treatment, I wound up having quite a lot of treatment that had essentially left me disabled and unable to work, which is not a super fun thing to have happen to you when you're 40 years old. So again, that kind of, not being in the typical demographic, that's maybe not something the doctor's considering. It's just like where you are in your life and the responsibilities that you have and the expectations of, what the rest of your life is going to look like. So that was a really weird whiplash for me because it stands out of the 5 years now. And I've met many, many doctors, different surgeons, different nurses. And I'm like, this person was the only one who completely invalidated me. And it was the person I had been sent to cure me. And so that was a bit of I still struggle with that, like psychologically making sense of that. That, like, wow, the person that they sent to, and they're like, you can cure this person. And they were like, I don't really feel like doing that. So yeah, it was really upsetting. It still is. And it does make me wonder again, just because of this person's practice, if they usually just see only 1 or 2 kinds of patients and didn't really know what to make of a new kind of patient.
Oh gosh, Laura. Emi, why don't you tell us a little bit about once they actually used that cancer word, how long did it take for you to get through the process before they could actually recommend a proper treatment?
Well, it's really interesting listening to everyone's stories, both in terms of pre-diagnosis and then after being diagnosed. And what I hear and what is similar to my experience is that the more aware your practitioner is, the more that they are understanding that this can happen to anyone with lungs, and the more that they're looking for it, and the more that they're responsive, that's critical to the treatment path. I mean, Laura's treatment story is heartbreaking to hear. And and for me, what I lacked in the diagnosis phase, I did see in the treatment phase because I was referred, well, I was had gone then into the ER because I was feeling sick enough at that point that did expedite my testing because now I was in the hospital, so I could get all these tests quite quickly. And I had a respirologist who really was excellent and moved things along and realized, what a shock this would be to someone like me. And but even though that happened, and even though all that testing had come back and they had found out I did have cancer, from that point, which was mid-September, I didn't get in to see an oncologist for yet a whole other month. And that was a month in which I had been told I had lung cancer, but nothing else. And now I understand that that was because they were doing really important testing to determine what kind of treatment I was eligible for. But no one told me that, and no one supported me through that. And so, unfortunately, if you're left to no information, you're going to seek out your own. And so I would Google things and, read things about how critical it was that I get access to an oncologist right away. And yet I wasn't even getting a phone call from the cancer center at that point. Luckily, the cancer center had referred me to a social worker, and she was the one who was actually saying, okay, I can see this treatment, this testing is done. Now they're just waiting for that. It'll probably be a little bit more, but that's not the way I should have received that information. I shouldn't have been getting it secondhand through someone who could just had access to my charts. And that's a really other key aspect that we're not even getting into in this discussion, which is not only is there a lack of treatment and diagnosis, but also a lack of support. When you're given this diagnosis, you're in this dark period until you can finally get in to see an oncologist. And I didn't know what any of those terms like EGFR or ALK, these were all new terms for me. So even when the social worker was spewing those off, I then had to go look and see what they were. And again, that's really not the way that the medical system should be working, and the kind of support you need when you've been given a diagnosis like that. So even though I did have a treatment delay, and the genomic testing certainly took a long time, but somebody should have been there to support me through that and to support others through that. And I think that's a really important piece that's overlooked often.
Oh, thank you so much, Emi. One thing that we're struggling with is when we look across the provinces, and again, I don't have information about every indicator that exists, but the vast majority of the provinces that I'm aware of can't even tell us how long the period of time is, or what is the appropriate amount of time from when that first abnormal picture is obtained to when someone should have their complete workup. And so if we don't have a benchmark to work from, how are we going to improve when every province is doing things a wee bit differently? And how it may be in Alberta where there may be imaging, but there may not be enough physicians, or in other provinces where we've got the physicians, but then we don't have the pathology or we don't have the radiology. It still means that people are trapped in a system where they are on a merry-go-round and they feel like they're just waiting for it to stop so they can get off and actually walk forward. I'm going to take a split second because we do have one more of our panelists who was just able to join. I see Katie. Katie, we're just talking a little bit about right now system breakpoints. So we're talking at this juncture of once you've been told you have lung cancer, did the system actually move forward in an expected way? Were there hiccups along the path after someone actually spoke that C word to you?
Yes, and hi everyone, and thanks for hosting today. I think this is a very important conversation. I'm glad I can attend for a part of this. So when I was first diagnosed, the biggest part for me was getting that initial diagnosis. I had 6 months of a very interruptive cough, and it took several tests, specialists. I was on puffers, and even when the scan came in showing a mass, it was assumed it was a blood clot, and I was put on hold for a little bit of time. And I think that all looked at the denial of someone. I was 33 at the time, that there was no way that this could probably be cancer. And so I continued on until I finally got testing done and more scanning done, until I could finally get that cancer diagnosis. I do have to say I was fortunate. I was downtown Toronto and I chose to have my care at Princess Margaret. And so from that referral, which didn't take too long, I was in the hands of some wonderful folks. And so I won the postal code lottery. I had access that from then on in went quite quickly. And if it can be done anywhere in Canada, it should be everywhere. And as I went on my journey, I felt very fortunate, and I felt that I just assumed this happened everywhere. And it wasn't until I learned of other people's stories, talking with other people, educating myself, that this was not the case. And that is why I advocate today, is because I know how just life-giving. It truly was in every way, shape, and form. My mental health, how returning to work, how getting back on track, how that process went. And it was very heartbreaking to me to hear that so many people didn't have that process or that quick turnaround. And so I want to make sure that that happens across the board, and it doesn't matter where you are or where you live. I've since then moved to Victoria, BC, and I can continue my care. But I cannot say how grateful I was to be in Toronto when that happened.
Oh, thank you so much, Katie, for sneaking in a little snippet of your journey. And I'm thrilled that you managed to find your way through all of the gauntlet to get to the
Yes.
right person. Um, Frances, your story with Anne-Marie. Anne-Marie was one of the first people in this country to have been diagnosed with ALK-positive lung cancer. From your perspective as that caregiver who was actually supporting someone through this journey, what were your thoughts around how the system, moved, and did you feel like things moved in a reasonable fashion?
I think in her case it did, but I think it might have been unique because she was diagnosed quickly. She went through the operation and everything quicker. Hear me?
Yep.
Okay, good. As I say, the system she went through the system quickly, which was really good for her. From my perspective, I think that related, especially when they're young. And the system is geared mainly for the children that have cancer and also for the older adults, especially, well, all cancers really, but also when the cancer comes back, it's like from, when a child has it, it does come back. So they have to do something for these, it's sad to say that, I mean, they're so isolated. I mean, for me, I mean, it was good for her we were a good support team for each other, let's put it that way. And we're very optimistic. We're very hopeful always. And I think this keeps you going. If you have faith also, that helps quite a bit. I think the system I think the doctors have to kind of explain to their patients some of these terms, because when they hear, they're bombarded with all kinds of, what they know and what they don't know, and medical things most people don't really know anything about. And I don't, as people were saying, they don't explain it. If they're going to wait for 3 months or 2 months or whatever for a diagnosis, they should be told and tell them the steps, kind of thing, rather than having them to find things out, or even if they don't do it, have somebody in the office or another system, let's say, to provide that for the patient, because it's very important. It's very important that they don't go, they don't know where to go. As soon as the treatment stops, kind of everything stops. You're on your own, and they have to forge for themselves. So this is a very important thing.
Yeah, I think knowledge is power.
But I was there for the big, from the, and also it helps that somebody going through cancer that has somebody there to support them. That's very, very essential, I think.
You're absolutely right. I often say that luckily, cancer is generally a team sport, both on the healthcare side as well as on the patient side. And it's important to lift us all up together. And I think the statement knowledge is power is a real one, right? And the places that your brain can go when you're sitting in a space that's a vacuum of lack of knowledge, is a really scary place to be. And I think that that's what we're hearing today is we've got a gap in awareness that, lung cancer is a diagnosis that can happen in anyone who has lungs. And then we also have a gap here in that the system just isn't moving as fast as we would like. To be honest, we don't even know how fast the system is moving. But what we do know is that the physicians who are on the receiving end when someone comes through the diagnostic journey are often dissatisfied with the amount of time they spent getting to that right treating physician. So, right now, I think awareness is still anchored in an outdated understanding of risk. We never talked about the thought that someone could be diagnosed with lung cancer who didn't have a tobacco exposure, an occupational exposure, asbestos exposure. All we thought about was the exposures that put people at risk. And we never learned about in school, and maybe that's my own background, but I would imagine, Stephanie, you probably had the same thing where in your brief little snippet on cancer, that was the pattern that was put into your head, and physicians treat on patterns, right? We are now seeing more women being diagnosed. We don't generally have obvious risk factors. A lot of times the risk factors that you make you think lung cancer aren't there, and we're not recognizing lung cancer early enough. And so we have an opportunity to change things. If we can shift how the healthcare team understands lung cancer, both in the public as well as within primary care, we can start to close the gap, right? We can help to have people advocate for themselves. We can hope to have a healthcare team that actually thinks of this when they see this constellation of symptoms. What you saw at the beginning of today's session was a preview of the work that we've got moving forward, and it's something that we've been developing with partners at a company called Titan One. This program is grounded in lived experience, and it's shaped by the realities that you've been hearing today. It's a campaign that challenges the assumptions that many people have about lung cancer. And the goal is to help ensure that more people, particularly women, who don't fit the profile, who don't fit that expected picture in the head, are going to be recognized sooner. And it features some of the women that you've heard from today. So I'm going to pass the mic over to Laura Davis-Seville from our partner at Titan One, and she's going to take us through the campaign. Thank you, Laura.
Amazing. Thank you so much, Roz. And thank you so much for having me, everybody. This has been such a moving forum so far. It's so incredible to hear all of your stories and, of course, see some familiar faces from all of the incredible women who helped us out with this campaign. So super excited to show you this today. I'm the head of strategy and creative at Titan One and have been on this campaign journey with Peter and team at LCC for a while now. So we're so excited to see it come to life. Our founder and co-managing partner, Scott Lanaway, is on the board at LCC. This is a very near and dear cause to his heart, and by extension has become a very near and dear cause for all of us as well. So it's been an honor and a privilege to do this work with you, and so excited to be able to showcase it and preview it with you today before it goes out to market. So as Roz mentioned, and as so many of you have mentioned, when we started this journey, this was the big hairy problem that we were really tasked with. How can we start to address this? That lung cancer truly is a disease understood through an outdated lens of risk, and so many of you today in your stories that you've shared have really hit on this. Emi, even hearing you say, don't worry, you'll never have anything to worry about. You've never been a smoker. So many of you have this common thread in your story. And so how can we start to, really change these perceptions? Not just amongst the public. I mean, obviously we do want more and more members of the public, especially women, especially people who do not fit the profile, the stereotype of a lung cancer patient, to recognize the signs earlier, to understand that lingering cold is something to look into. But also to hit that physician and primary care audience as well. So this campaign really is intended to do both as we look at making a difference. So, and this also has been a key theme today and really became the linchpin for how we move this work forward. The scary truth is all of that is very outdated. All of that is no longer true. We are seeing such higher incidences among women, among younger Canadians, among people who don't fit that profile more and more. And so many of you have used this very line today that anyone with lungs can get lung cancer, and they very much are. And this really is the big piece that we want to uncover for both of our primary audiences as we move this forward. It doesn't matter if you're young, if you are healthy presenting, if you are health conscious in your choices, if you've avoided tobacco use, if you've avoided all the other horrible exposures, if you've been active your whole life, if you are, as Laura said, not the 70-year-old former smoker male wanting to get back to the golf course, but you are a woman who is strong and capable and young, that you are, it is very possible. And while we don't want to fear monger and we don't want to create unnecessary fear in the public, there definitely is that element of wanting to pull the wool from people's eyes to some extent, because these people are overlooked. It's something we want to change. I know it's something that is, the major topic of today. How do we change that? How do we make sure that these people are not overlooked when they do present certain symptoms, that doctors aren't discarding it and aren't diagnosing 9 other things before you're getting into the right treatment? So this really was our big goal with this campaign, was how can we pull the wool from people's eyes? Again, not fear mongering, but making sure we have that record scratch moment. I mean, as you know, as I know, having done this for 20 years, people are bombarded with over 200,000 commercials and messages a day. We do have to break through the clutter. There are also obviously a lot of other advertisers in the cancer space alone, in the health space alone, trying to, advocate, raise awareness for their causes as well. So how can we make sure we are bringing that boldness and that passion that we're hearing from everyone around the table today about how much this needs to change? So that became kind of the impetus for the work that we're doing. How can we boldly shatter the stereotypes, really look at these perceptions and make sure that people are looking at lung cancer in a bit of a new light? So this was our big idea. Lung cancer doesn't care if you're in your 20s or 50s. It doesn't care if you hike or cold plunge or can run a sub-5 marathon. It doesn't care if you won the Stanley Cup. You can do brilliant things in life and still get lung cancer, because if you have lungs, it can come for you. This campaign will focus on exceptional lung cancer patients, the ones whose accomplishments are anything but ordinary, to show just how indiscriminate lung cancer is when it chooses who to prey upon. Pulling inspiration from Nike, Adidas, and the world of sport will show that lung cancer can come for you, no matter what you've achieved. Because at the end of the day, lung cancer doesn't care what you do, who you are, how old you are, what gender you are. So our call to action is make sure that you do. If you are on the public side, make sure you know the signs, make sure you're doing self-screening. If you're on the physician side, to Roz's point, we know what you were taught in school, but start to see this in a whole new way so that you're catching it earlier and we can save more lives. So this was our vision overall for the campaign. So as we heard in the idea statement, really looking for these evocative kind of sport-driven imagery, something you wouldn't expect from a typical cancer ad. We really want to pull the rug and kind of do this in a very different way. Again, that breakthrough is so critical to what we do. So looking at people in their prime of life, strong, in their element, really real, really authentic. And we were so fortunate in bringing this vision to life to be able to work with Laura, Katie, Bev, and some great other patients who sort of helped us tell this story through their own lived experience, but through the lens of this breakthrough concept. So this is just a little sneak peek of the campaign. We've developed some, wonderful digital and social assets. There's some video assets as well. We know we played one off the top. I think we're going to play it again for you in case anyone missed it while you were coming in. But you'll see, with each of these, the patient themselves is at the forefront of this story. We are talking about what they've accomplished, what they've been able to do, really moving away from these stigmas of any exposures or lifestyles, habit choices, all of that we're moving away from to show, again, that anyone, even those who are doing these incredible things in life, can get lung cancer and are susceptible.
I ran a half marathon. I made spending time enjoying the outdoors a priority. I completed 4 10K races. I was working out 5 to 7 days a week. And at 33, I was diagnosed with stage 4 lung cancer.
So that is the first of several videos and assets that we will be launching into the market featuring the amazing Katie. And we have some other great work coming as well. So again, a huge thank you, Katie, Laura, Bev. We could not have done this without you. Would love to turn it to you right now just to see about your reactions. I know you've all seen it before, but again, we're so grateful to have you as part of it.
Thank you so much, Laura. And thanks to the whole team at Titan One, and of course, our very special Scott Lanaway, member of our board here at Lung Cancer Canada. That's great work, and we're so excited. So coming now to our participants in our conversation today, Bev, you're one of the featured patients here. How do you feel watching this type of social media launch, and how do you think that might have changed if that had existed for you before you were diagnosed?
So first off, let me say I was really honored to be part of it, and I absolutely think it is outstanding. The message is so powerful, and to see those young faces, I don't have as young a face anymore, but we can't do enough to raise awareness, and it just kind of fuels my passion to keep doing what I'm doing. I think that lung cancer is so under-recognized, so underfunded, and we're under-resourced. And partly what drove me or empowered me to get into advocacy and my willingness to speak out and raise funds for lung cancer is I was very jealous. I was envious of the more popular cancers, if I could call them more popular cancers. And yet lung cancer is the biggest cause of lung cancer deaths. And it breaks my heart when I see young women. It's one thing for me. I had a son, I've got granddaughters. That was my biggest worry. They would never remember who I am. And I see somebody in their 20s, 30s, 40s, life just changed dramatically, partly because, and maybe largely because the system isn't recognizing it. So I really applaud this, and I think it's just tremendous. Thank you.
Laura, one of the most compelling parts of your story that I really heard was the fact that you did care. You were like, this is my experience of being diagnosed with cancer and now being in the system, but you didn't find that was validated at that time by the healthcare team that you were working with. Do you think that if you had, opened up your Instagram at that time and seen something like that, it would have changed your perspective, maybe not made you feel so alone? I'd love to hear your thoughts there too, based on your experience.
Yeah, I do think this kind of campaign would have helped a lot, just going through the times of uncertainty, because it is very lonely and it's surprisingly hard considering how many people get a lung cancer diagnosis every year. It's surprisingly hard to connect with other people. And so having that kind of be out there publicly and be something that just, pops up, right? You're not even looking for it and there it is. Just helps you feel like, it's not just me, I'm not the only person experiencing this. And it leads you to a place where you can connect with people, but even before you have that, direct connection, you have that indirect connection of just knowing you're not alone, and how much that can help you feel, okay, maybe I can face this now. Maybe there's other people going through it, and I can go through it too.
Great, thanks. Katie, how does it feel for you as the patient to see yourself up there and see your story?
It's a combination of things. I think when I see it, it really brings me back to how I felt I got diagnosed. I was working in my career, I was running, I was active, I was trying to be outdoors, I was doing all the healthy things. And then immediately, kind of how my photo shows up in this video, diagnosed. And that is exactly how it felt. So this campaign really relays that I'm going on with my life. I have this interruptive cough. I'm sure it's going to go away. I hope it goes away. And then to be diagnosed so suddenly, um, it's still something that is emotionally hard to think about and go back to that day or those few weeks, because I really thought that was it. And I couldn't comprehend how my life would have folded out at 33 years old. And so it's really empowering to also see it, because when I was diagnosed, I heard of people my age getting breast cancer, women, that was more or less the common one, maybe skin cancer. And the experience that they had was much different. They would get pamphlets, they'd get explanations, they had galas, they had a network of support for young mothers or young in your career. There was more resources built out. And here I am with a lung cancer diagnosis, and I'm just getting asked if I, from people who didn't know me, if I was ever exposed to something or did I smoke. And it felt like I was having a very different experience and a very different support network and a very um, different, yeah, just a very different experience because I had this lung cancer. And if I went on social media, I didn't find anyone young talking about it. And to this day, I still don't see them because there is a stigma attached to it. There are people out there like me, but they're not speaking about it because it is a stigmatized disease. And it isn't seen as something that should be spoken publicly. And I don't like that, because to everyone's point here, if you don't see it, if you think you're the only one, which I absolutely did for the longest time, it's a very nerve-wracking space to be in. And so if I did see this come out, whether it be just before diagnosis or even after diagnosis, I think that would even help me even more so, because I would just see it and think, okay, this happens. This, or I could share it with people to say, see, this is someone else who's had this. And so not only do I think this is such a great awareness prior to a diagnosis, I think there's so much power for this to be shared amongst our community, to see someone that looks like them. There's such a range of people in this campaign, which I think is incredible and so impactful to see all the different faces and different backgrounds.
Thanks. Now, Emi, you have been certainly not just within Lung Cancer Canada, but within the lung cancer community in Canada in general, a major voice, sometimes tireless, it seems, in your ability to advocate and to get that voice across. And one of the things I've most appreciated from working with you, of course, you're a member of our board and you've done so much with us, is your willingness to actually speak to other patients. You've been a cancer buddy for my own patients, and you were even referred to by one of my dear patients as her cancer mom. You could talk to her, and she was very young and very scared, and you were actually somebody who understood and could speak to her. So you've given so much, and we heard from your story that when you started, you were all on your own. How does this campaign resonate with you?
Well, there's really a couple things. When I was diagnosed, I remember telling a good friend of mine, and she was shocked. I was shocked. And I said, you shouldn't be so shocked. Lung cancer kills 2.5 times more women than breast cancer, and has since the 80s. And she said to me, why don't we know this? Why isn't anyone telling us? And there's been a real disservice to women and to young women by not getting this message out there. And that's what this campaign is so inspiring to me, is because we're finally getting our stories out there. We're finally being heard. We're finally being seen. And hopefully other people will look at this and start to realize that anyone can get lung cancer, and that will destigmatize lung cancer, because the reality is the stigma is a fake. The stigma is a fraud. It's not true. If you have lungs, you can get lung cancer. All of us on this panel are all here living that experience. And so we need to get rid of that completely. It's an excuse, really. It's a fraudulent excuse to not support lung cancer, to not support lung cancer patients. And it is really lonely. And it's surprising to me how many people are diagnosed with lung cancer. And yet we have these events for lung cancer patients, and Lung Cancer Canada is available for so much support for people, but we can barely find them. They're not willing to come out. And so what a huge moral disservice this fraudulent stigma has given to people. And we're here and we felt lonely and we're not living that stigma. You can only imagine how people feel who are living that stigma. And I've heard from so many people who treat lung cancer about some people who have had a smoking history who refused to be treated because they felt like they deserved something. That is heartbreaking. And that's really a whole flip side that we haven't even talked about. So an ad campaign that really head on fights that's wrong and lying stigma is so critical. And I'm so happy that we're finally able to get that out. And I can't wait to see the change that it will bring.
Thank you, Emi. Sometimes I must be honest, I feel like a broken record in my clinic when I do treat patients who have a history of tobacco use. And I have to tell them over and over, this is not your fault. If the fault lies anywhere, it's with the tobacco companies, but it is not your fault. And you deserve as much care and as quality care as any other cancer patient. So thank you so much for bringing that up and the stigma that colors the experience for so many of our patients. I'd now like to open up with a more general question, maybe more pragmatic. For those of you with the lived experience, what do you think it would take for a woman walking into looking to get care today for a cough that just won't go away or just not feeling great and unexplained weight loss? What do you think it takes for that woman to be taken seriously in a consideration for lung cancer today? What advice would you have? Anyone feel free to jump in. Yes, Bev. Oh, sorry.
So I think that that person has to be strong and say, this is real, what I'm experiencing, and that they should feel very comfortable in advocating for themselves. And Frances, in her comments, talked about how important it was for her to be able to accompany her daughter. And I think it can help the individual who may feel very lonely and alone to have somebody with them and saying, no, this has been going on too long. There is something wrong. And so I think we need to be able to advocate for ourselves. And as you pointed out in your comments, Stephanie, we deserve to be heard.
Bring along your mama bear, in keeping with our theme along Mother's Day today. Any other thoughts from our participants today?
I think too, it's really important that, and one of the things that's amazing about this ad campaign is that it speaks both to individuals out there, but also to family physicians and to other physicians, because really they are the gatekeepers. And the more that we can make them aware of this issue, I mean, it's I would think it's shocking that my family physician told me as I was walking out to a super delayed x-ray, don't worry, you have nothing to worry about because you didn't smoke. That was only 7 years ago, and I'm in the advocacy space, and I can tell you, I hear it over and over again. And I've spoken at family physician conferences, and people say, "Oh, I haven't really thought about that." And so we really need to get the message across all groups, and particularly to family physicians, so that they understand this is a really big problem and a growing problem, and they need to be able to recognize it because unfortunately everyone should advocate for themselves, but not everyone can. And so we really need, it's a disservice to everyone if we're not properly educating family physicians on this issue. It's a disservice to the patient, but it's also a disservice to the physician who's trying their best and is I'm sure wants only the positive outcomes. But if we're not arming them with the tools to enable them to do that, then everyone loses. And so I'm so glad that this campaign has a huge aspect of educating family doctors. And I think that's a really important aspect of this campaign.
I'll jump in and just say I always hate to say this to other patients, but you do have to advocate for yourself. It's the worst advice I hate to give. And that has many questions built into it. And I knew I had to. I tend to be a people pleaser and I tend to not want to ruffle feathers. And that is a really hard thing for me to go up against someone who has much more knowledge. I don't come from a medical background. I'm trying to navigate a whole new disease with many acronyms. I think this has been spoken to on this panel already. And that was hard. And how I advocate for myself was a big question. A couple tools that I found helpful was to really relay across, the early part, which was contrasting. So before I could do this, all of a sudden, without no real change in my life, now I'm dealing with this. It's getting worse because I can't do this. I could do this. And those things really help when you are stuck and sitting in an office and you feel like you're not getting better, is the contrasting really helped. But I do find when we say advocate for yourself, it's really hard. So I really like to have tactical reasons of how you can explain what needs to be fixed. But if we could have tools that help that, not everyone is comfortable having those advocating conversations.
If I can build on what everyone else has said, one really specific policy change that I think would make a big difference is to expand screening programs so that they're in all the provinces, in the territories, and that they're at the very least just based on age, the way other cancer screening programs are. Because right now, when you have lung cancer screening, that also requires an additional factor, right? It's not just age, it's also there has to be a substantive history of tobacco use that reinforces the message that those are the only people at risk. And it reinforces that message to the average person, and it reinforces that message to the family doctors who learn about this program and say, oh, I need to refer my at-risk patients. And so here we have this same idea again that, oh, if you don't have this additional factor, you're not at risk. And so as long as we keep using that language and as long as we keep using those parameters for the screening programs, we're going to keep sending the same message over and over again that you don't have to worry. There's going to be that family doctor saying, you don't have to worry. You're not at risk because you don't even qualify for screening, which is not the message that these screening programs should be sending, unfortunately. And of course, if we did expand screening, we'd have the added benefit of catching more cases and catching people earlier when they have more options and they don't have to go through months and months of trying to be listened to and trying to be heard. So yeah, just as a practical policy change that could really make a big difference. I would love to see that happen in all the provinces and the territories.
Well, why don't we shift, Stephanie, to that concept of solutions? If the reality of lung cancer has shifted, what needs to change so that the system keeps up? What would it take for someone with obvious risk factors to be recognized earlier? And then what would it take for someone who doesn't have any obvious risk factors to be recognized earlier? And the one thing that I can see, and I do believe is going to be part of this campaign to the different frontline people who are seeing people with symptoms, is one of the things I would bet that none of you received when you presented with that first symptom of cough was, when should you follow up if it doesn't get better? Right? Because that's the piece. They're like, this is likely an infection. This is likely your asthma. This is like they give you the top diagnosis, and statistically they're right. But when do you need to come back? Because that's that piece that the people pleasers like Katie are going to be like, well, they told me the cough was going to take a while to get better. What's a while? No one gives you a quantity on a while. And so you just sit and you're like, well, I don't want to bother. And I know how overwhelmed the family doctors are. And so this is probably still a while. And then what you don't realize on the back end is even when a while has long passed, it still will take potentially months of time to get that next diagnostic test. And so one thing I think that can be incredibly impactful is providing people on guidance of when to come back, right? If your cough doesn't get better in 8 weeks, you should probably be seeing me back so we can start thinking about if there's something that we've missed. I would love to hear other folks and suggestions. There's folks in the chat wanting to talk about technology, and I do think technology is helping us. There was a query in the chat around something called a liquid biopsy. A liquid biopsy is actually a bit of a misnomer because the information that we get off of the blood test known as circulating tumor DNA isn't actually a diagnosis. It can augment a diagnosis to help us figure out precisely what subtype someone might have or to help us choose a treatment, but it actually doesn't provide a diagnosis as the test exists as it sits right now. But I do agree, you know, there's actually multiple studies that are going on in Canada, especially looking at our Aboriginal patients, our rural patients, our folks who are struggling from a socioeconomic perspective. Could something like integrating circulating tumor DNA early in the diagnostic journey help shorten that amount of time that someone is spending before they can actually get a proper treatment recommendation and take that next step? So that's work that's ongoing right now. But I would love to hear if there's other lived experience recommendations for folks like Dr. Snow and myself to take back and think through how do we garner the evidence to try to figure through that this is something that will be helpful. Now go ahead, Bev.
So the first word that jumped into my mind was resources. Lung cancer needs, as a disease entity funded in the Canadian healthcare system for all, needs to be recognized for the how expansive it is, and money has to be allocated to that. I definitely believe in the individual self-awareness, knowing something is off, if it's not going away or it's persisting, doing something about it. And a very graphic example of a young woman, I think she was in her mid-30s, soon after I was diagnosed, every time she lay on one particular side to sleep at night, she had just a little minor pain, but something not it shouldn't even describe it as pain, but it didn't go away. And that was enough for her to say something is off. And she sought advice, saw her doctor and had an x-ray, and an incidental nodule was found. Liquid biopsy would be a very valuable way for testing, but I also think biomarker testing, and that's expensive. That takes time, that takes resources, it takes a lab, it takes pathologists. But I think that those are the areas where money has to be placed to make a difference. Because if we're showing up at our GP's offices and there's no place that they can send us to, that's going to be frustrating and a problem for us.
Francis, I think, do you want to make a comment on this? Some solutions that you have that are front of mind?
Well, I guess it's a bit of a solution. I think that when people go to a doctor and they have this cough or whatever, which is one of the signs, I think, of lung cancer, if they don't, can they press the doctor to send them for an x-ray? Because I think this is very important. From, if you go a few weeks and a month that you're coughing, and nothing is being resolved, I think the physician should take the initiative to send them to an x-ray, or for the patient to advocate for an x-ray. And the referrals can go from there. But I mean, I think this is the first step to get it through to the doctors that, these things, the quicker you go for an x-ray, the better it is. And it rules out all kinds of stuff. So why not do that at the beginning?
And x-rays are cheap. And at the end of the day, But before you put somebody through maybe a second course of antibiotics, you should stop and think
Exactly.
if I missed something.
Yeah. Yeah.
Any of our other panelists want to make some recommendations on solutions?
I think that one thing, there's so much pressure. We hear it all the time of economics on the healthcare system, but I find it personally frustrating that there's not enough pay attention paid, in my view, to preventative. I mean, so much the studies are just repetitively coming out at how much money, even just leaving aside the incredible healthcare benefits for the individual who's diagnosed early and then maybe can go for a cure. Leaving that even aside, the monetary amounts that could be saved on our health, the pressure on our healthcare system, it's just hard to fathom um, why those aren't being acted upon. And so I really feel like all of us, should be speaking to our members of the Legislative Assembly and Parliament and everywhere about, why are we not screening for lung cancer? We screen for many cancers. Why don't we screen for lung cancer? It's a really telling question. Why don't we? And often the answer comes back, it's older people, but it's not older people anymore. And that's what we really need to get out there and I don't understand why in a time where there is so much economic pressure we aren't looking at the amounts that would be saved by these programs and implementing them. And so we really need, I think, as a lung cancer community to make those facts known to our politicians and really get them moving the needle on these critical campaigns.
And Emmy, you bring up an incredible point. We have known about the benefits of lung cancer screening, and this is just your average lung cancer screening that's aimed at people who are considered high risk. And that risk is based on a number of factors, including a history of tobacco exposure. We've known since I think it was 2011 that we not only can reduce deaths from lung cancer, but lung cancer screening is the only screening test that actually reduces your chances of just dying in general. People actually live longer when lung cancer screening is part of healthcare. And somehow that gets missed. And so it is a real struggle that here we are 15 years later, and the only provinces in this country that have screening rolled out are British Columbia. Ontario's most of the way through. We're not complete with all of our sites. Gosh, is there one other pilot? Like
Nova Scotia, we're almost all the way. We have
Yeah.
one district left at this point.
But this is patchwork, right? And so there are provinces that have no access to screening. And part of the struggle that Emmy highlights is when we put people through screening, there are healthcare costs incurred on, radiology and respirology and thoracic surgery. And where the money is saved is actually on treating people with stage 4 lung cancer. The treatment for stage 4 lung cancer lives in Stephanie's, in my realm, right? It's drugs that we give to people, which are in most circumstances attempting to buy time and not curative. But because healthcare budgets live in silos, there's money to pay for physicians, there's money to pay for drugs, there's money to pay for radiology, there's money to pay for pathology, but there's not just one big bucket for lung cancer funding, right? And lung cancer can divvy it how it sees fit, and it can pivot funding that's dedicated to lung cancer from drugs to surgery or to CAT scans. You have to try to figure out how to maneuver the funding in other ways. And that's a real sadness is that we can't be nimble when it comes to these things because of the way that the funding is allocated. And that's a terrible excuse for us to not make change. And I think we all felt the hardship of the pandemic. Pandemic has set us back a decade in lung cancer screening. And there's actually research projects that are ongoing looking at what that has meant to lung cancer in general, as well as several other cancers. But this is a big deal. We need to figure out how to find folks earlier. We need better pathways to follow people who do get found with a pulmonary nodule to make sure that it doesn't turn into something more sinister. We need to figure out how to do better. We need to figure out how to get people through that diagnostic phase faster, and monitor them more closely.
I did want to add one quick
please.
mention, just on the topic of, Francis saying how important it is to get an X-ray. So I waited 6 months, about 6 months, just under 6 months, going through all of these asthma puffers and waiting for a specialist. And then I had to push for an X-ray, and that showed the mass, which we thought was a blood clot. In that time, if I could have had the X-ray sooner, there could have been a chance that I would have felt more comfortable putting off my treatment to get my eggs frozen as a young woman. But when I was diagnosed, it was so bad, the prognosis at the time, before I knew my biomarker. And my husband and I had to make the decision that I go on treatment immediately because we're not having kids if I'm not here. And so I want to say, for the young patients out there, they probably will not get the advantage of a lung screening program unless it is for if you're 20 and up. But for those of us being diagnosed in our 20s and early to mid 30s, the X-ray is so critical. And I would encourage you to do that, because I could have had a different outcome in my life and how I continue to live my life. Especially as women having to consider egg freezing, family planning.
Yeah, that doesn't happen overnight.
No.
Very, very different when you're talking sperm donation versus egg harvesting and the amount of time and effort that it takes to put that in it. And that's awful that you're put in a position where you feel like you have to make that choice. My heart goes out, Katie.
Thanks.
I'd just like to make one more comment, if I can, Roz.
Yeah, please.
The theme of screening, because what we have started to see some evidence of in Canada, we've definitely seen that from our neighbor to the south in America, where they have had access to lung cancer screening programs for a lot longer, is that even when they do exist, sometimes there's poor uptake. And I think it can be very complex from a psychological perspective, because right now, lung cancer screening candidates are those patients by definition who are higher risk. And there's got to be fear. Just that word of cancer and lung cancer is terrifying. And so I think some people are scared to check, scared to find out. And what we know as the healthcare providers, we find it early. The chances of cure are so much higher. A stage 1 cancer versus even a stage 2 or 3 cancer, which can still be cured, but it's much more complex, a lot more evolved in the treatments, and has a higher risk of relapse. So if anybody participating and watching today knows somebody, if you're lucky enough to live in a jurisdiction where screening is available and they may be eligible, encourage them to have that conversation. At least here in Nova Scotia, you can self-refer. You don't need to have a primary care provider or be referred. And even if you don't meet the eligibility, if they're a current tobacco user, there's often a lot of supports that will come to support them with tobacco cessation, which is so good for your health in many ways, even beyond the cancer risk. And so if you can just talk to one person and direct them in the right direction for screening, it can make a huge difference to that one person's life.
No, I absolutely agree, Stephanie. It's hard, right? Because we want to encourage people to make healthy choices, whether that's quitting smoking, whether that's exercising, and protecting the one body we are all given at birth. But at the end of the day, we do have to engage in our own healthcare system. And I know that that's hard. We sit here, again, you have heard today from people who are connected. It's a very different tone for folks who don't have a family physician, who are seeking their healthcare through walk-in clinics where there's no continuity to know that you've been complaining about this cough for months on end, and it feels like Groundhog Day, where the wheel is being reinvented over and over again. And we're not deaf to that, there are lots of aspects of healthcare that need resource. We're just trying to make sure that antiquated thought that the only people who get lung cancer are smokers is dispelled. So I would like to thank all of the voices that have volunteered their time and their stories to move each of us today. The perspectives that you bring to the conversation, your honesty, your reflections, your willingness to revisit these difficult moments are what ground our work and what inspires people like Stephanie and I to continue to do our jobs and volunteer for other jobs each and every day. These are not easy stories to tell, but if we didn't have you here, we wouldn't have the understanding of where the system is falling short. And that is the one thing, is there's just not enough voice for lung cancer. And we need those voices to actually move forward change. I want to thank my colleague, Dr. Stephanie Snow. I still remember meeting her as I moved to Canada, and so grateful to have her as a friend and a colleague. And thank you so much for helping leading this conversation today. To all of you who have joined and contributed, thank you for bringing your perspectives to this discussion. This work and our advocacy policy series wouldn't happen without our sponsors who support this work and make these types of conversations possible. So I would like to thank AstraZeneca, Bayer, EMD Serono, Merck, Regeneron, Roche, and Takeda for helping to make this policy series possible. We started today with the reality that challenges how many of us think about lung cancer. We're seeing more women being diagnosed. Many don't fit the profile that you might expect to see when you think lung cancer. And what we've heard today is the system is lagging behind. The system has not caught up to the reality of lung cancer in 2026. What we've heard, these are not isolated experiences. I hate to tell you, even though I realize that, Laura describes herself as a unicorn, and I would bet you each of you think of yourself as a bit unique. But I can tell you that if you talk to the oncologists across this country, we all have these people in our clinics. While you are unique as a human, as a unicorn, these are not unicorns, right? These are things that happen in the real and now. This is a pattern. This is something that we have to recognize. This is a pattern where women aren't being found early enough, they're not being diagnosed quickly enough, and they're not moved through the system in time. And it's not necessarily just a knowledge problem, it's a system problem, and we have the ability to fix a system. Today's discussion highlights several clear priorities that are going to inform our ongoing advocacy work at Lung Cancer Canada, as well as policy work that we're embarking upon. We need earlier recognition of lung cancer in general, but especially in women, particularly in those where the classic stereotype does not fit. We need screening. We need diagnostic pathways that reflect the reality of who is being affected by lung cancer today, not 30 years ago. We need to reduce delays across that diagnostic journey and through the referral pathway to get the person to the person who can dispel those fears and get them to the right information, to get them to the right treatment. If you haven't figured that out from today's conversation, lung cancer is not an immediate death sentence, right? I think that that's what too many people think is the reality, is that if that LC word is spoken, that there's no time, that there's no possibility, that there's no hope. But I hope each of the stories that you have heard today show you that lung cancer can be turned into a chronic disease. You can get back to work. You can get out and golf. You can get out and do all those things. Like I remember Anne-Marie buying a house that she never thought would be a thing. And she was like, I'm a lung cancer patient and I bought a house. These are a big deal. And we need awareness to realize, both in the public domain as well as in the physician domain, that it's actually going to lead to action. This conversation comes at an important moment for our organization at Lung Cancer Canada. We're just finishing up our reprioritization and strategic directions. And the thing that I've heard today as president of this organization is that we need to make sure that our priorities are always grounded right here with lived experience. And we want to make sure that we are aligning and helping the system to evolve to have its most impressive impact. So this is why this Lung Cancer Canada policy series exists. We want to bring together those who have lived experience, clinical expertise, as well as system leadership to surface the issues clearly and then help move the system forward. Lung cancer in women, including those without obvious risk factors, isn't a unicorn. It's not rare. It shouldn't be unexpected. It should not be missed. And women are not the exception. As we've said today over and over again, the only risk factor you have to get lung cancer is being born with a pair of lungs. It doesn't even have to be born with a pair. You could be born with one lung and you still have risk. This is the reality. It's time for our system to catch up. And I just want to thank each and every one of you for being part of this important conversation. So thanks to everyone who joined us in the audience. And I know we're going to have many people who are going to watch this. This has been recorded. And so this is something that's going to be available for people to watch after the fact. Please come to our website, come look at our educational materials. And if you want to talk to your family doctor, we're happy to help send our campaign in their general direction so that they can learn more about lung cancer. So I just want to thank everyone today, and we'll close our session.